Welcome, welcome, welcome to Wellness Wednesday, Thriving with Hashi. We have a special guest in the house today for all of you listeners and followers. Super excited to be able to have Dr. Alana J. Arnold here with us today to share with us about children's health tips and how we can be better parents at home as well as well-informed when we go to the doctor or the emergency room. So I'm just going to read her bio here. It's quite impressive. Dr. Arnold is a board-certified pediatric emergency medicine doctor, medical director, and founder and CEO of Premier Pediatric Solutions. Her work focuses on improving children's health in our community ERs and urgent cares, as well as giving families tools to gain health literacy. Born and raised in Philly, Dr. Arnold attended Tufts University School of Medicine in Boston. After graduating from Princeton, then she pursued her medical training around the country, finishing in Houston for her Pediatric Emergency Medicine Fellowship at Texas Children's Hospital, the largest freestanding children's hospital in the nation. She is a huge advocate for kids' health and is leveraging tech to allow clinicians to deliver better pediatric care in real time when pediatric specialists aren't on site, which occurs very often. Her work is critical in helping care for the nearly 30 million children that pass through our ER systems each year. Additionally, her direct-to-family kids health content is available online. This work empowers moms and parents to know how to care for their kids and gain medical knowledge. Wow. I'm already excited to dive into this, Dr. Arnold. Welcome.
Thank you. Thank you so much for having me, Robin. It's my pleasure.
Absolutely. All right, so let's get into, I know some of you had submitted some questions. So what we're going to do is just go through the questions and have Dr. Arnold answer and inform us, because knowledge is power. And then we'll go from there. It's going to be great. Okay, so the first question we have is, Dr. Arnold, can you share about pediatric care at home to help us and our child or children before going to the pediatrician or emergency room? Like, what do we need to know and how can we help ourselves help our children?
Yes, absolutely. So this is, as you can imagine, a very common question because obviously going to ERs can be labor intensive, stressful, and whatnot. And even though I love my job, I certainly you can understand from the parent's point of view, it can be nerve-wracking. So simple things that I recommend every household should have. You should always have a first aid kit. Obviously, kids are very active, and just for the safety of your child and anyone else in the home, having a first aid kit on hand is really important. So typically a first aid kit, it does not have to be anything very complicated. You always want to make sure you have Band-Aids and bandages that are sterile and clean, obviously. You want to have some type of antiseptic, so rubbing alcohol is fine, or even just hydrogen peroxide. And then typically an ointment of some form like bacitracin or neosporin to have in the kit is really helpful. I usually say, if possible, try to check the kit every month or every couple of months just to make sure that things are stocked appropriately and that nothing has expired. So number one thing is to make sure you have a first aid kit in the household. And then common things being common, like a fever or just mild aches and pain, you want to make sure you have the over-the-counter medications such as ibuprofen or acetaminophen. Having those medications, it will work wonders. Someone runs and sprains their ankle, give them a little ibuprofen. If someone's running a fever, give some acetaminophen. The medications are interchangeable, and you just have to verify the dosing. Everything in pediatrics is based off of the child's weight. But I would say those three things are really key: to have a first aid kit, just some ibuprofen and acetaminophen, and then also a thermometer. Fevers are very common in kids. They typically are running around and they usually have a snotty nose or something kind of year round, depending on the age of the kid. So having those components in your household will kind of serve as a first line so that you can check temperatures, treat mild aches and pain, treat fevers, and then make sure you have proper bandages in place in the first aid kit if there's a mild scrape or cut or something like that.
Excellent tips. So what I got from that, and having a child, at home who now is older, but I can relate to the snotty nose and taking the temperature all the time. That's the first thing the doctor on the phone says to, what's the temperature? Are they above
Yeah.
98 or not? Is there running nose? Is there sore throat? Before you take them in. So having that first aid kit, absolutely. And I love that you said check it often, every couple of months, because sometimes you may say check done, I have it in my house, but then a year later you go to use it and maybe
Right.
more band-aids left. And
Yeah.
it's not going to help you in the emergency. So absolutely.
Exactly.
Yep. And then over-the-counter meds as well. So first aid kit, thermometer, and over-the-counter meds. Excellent. Good tips. Okay. Moving on to question number 2. What are some kids' health tips for busy parents? So a lot of the followers and moms and dads and caretakers that are watching this right now, they're super busy. They work full time. They're shuttling their kids after school, to and from sports and activities. What are some tips that can help the busy parent?
Yes, so this is very common, as you can imagine, just given the time and age that we live in. So I am a big proponent of keep it in your calendar, keep it in your phone. So if you have appointments coming up, make sure then and there as you schedule them that you block it in your calendar. And then I also will set a reminder. So everyone's a bit different. So say you have an appointment scheduled, usually I'll have a reminder a week out so that I remember, okay, to not have meetings or whatnot or other errands around that time. And then definitely the day before to set a reminder as well, so that again, it really keeps you in tune with the schedule for your child's care. Apart from making sure you keep up with your regular checkups and whatnot, it's really important to have the primary care information on hand. So that means easily accessible in your phone, your other caregiver or partner's phone as well, but also readily available in the house. So say, for example, you have older kids and they might be old enough to be babysitting a younger child. They should have easy access to the pediatrician's information as well in case an emergency does arise. So, classically people will have this stuff on the fridge or something, but usually just having it in your smartphone is really helpful. And then additionally, because obviously things can happen at all hours of the day, you want to make sure you have a means of contact for an after hours line. So if, for example, something happens at 9 p.m., you want to have a plan of care to say, okay, does my pediatrician have after hours line that I can contact? So it might be, an on-call nurse or another clinician who is answering the phone, but you want to have a plan of action. And all of this should be discussed with your primary care doctor on those visits, so you know how to reach them and what the plan would be. And then secondly, I would say really, really important, if your child does need to seek medical care, again, have a plan of action as to what is your preferred ER to go to. You don't want to be scrambling because it can be very nerve-wracking and you're anxious depending on what's going on with the child. So have a plan of care as to this is my preferred facility to go to, so that there's no guesswork there, and you want to have that available to everyone in the house. So if they're staying with grandma or whomever, they know, okay, if anything happens, we should try to go to this ER, this hospital preferably, especially if you have a child with like chronic medical issues. Typically, it's much easier on the clinician, depending on, if it's not a life-threatening emergency, to go to that home facility because they'll have all of the records and information about that child as opposed to scrambling and going somewhere else. And the same goes for just your local ERs and urgent cares. So having the information laid out as to your preference of where you want to go first, and then maybe a second line is really helpful. So having that readily available to all of the adults in the household, older kids who might be babysitting, other caregivers, grandmas, aunties, uncles who might look after the child are going to be very, very helpful, especially if there is an emergency that arises, and also, just in the busy lives of parents in general.
Absolutely. I think it's so important to have that communication and have that plan of action.
Mhm.
Because especially in an emergency, you really you go to panic mode. And if you don't
Absolutely.
know what to do, or you may know exactly what to do on a regular day, and I know from experience when my son was little, he was 18 months, and he had an accident in his gym class. He just rolled over a ball, but he broke his femur bone, and
Mm.
that moment, I'm like, he never cried. I didn't know what to do. I pulled.
Yeah, it's horrifying.
right? You know, it is. And it's scary as a parent is the worst thing
Yeah.
you can see your son or daughter or child in pain. And
Yeah.
I knew my plan of action, but at the same point I panicked, right? I should have called an ambulance. I didn't. And I
Hmm.
called my husband who wasn't in town and he
Yeah.
called the pediatrician. So I called the pediatrician and we're like 20 minutes away. We raced over there, you know, and I'm hoping
Yeah.
a cop comes so he can escort me and not pull me over for speeding, you know, and then
Right.
we
Right.
get there
Right.
and then we had to go to the ER. But, you know, once we got to the pediatrician, the plan of action was so succinct and, you know, they knew exactly, they cleared the room, they stopped all the other patients, they pulled us right through
Hmm.
and they knew exactly, you know, it's not life threatening, but he needs to get a cast. And they called the
Absolutely.
hospital, they told us which hospital to go to, exactly, they were waiting for us. But, you know, as a parent, it's scary and you
Right.
panic. So having that plan of action and sharing it with all the caregivers is really important,
Yes.
Dr. Arnold, as well. Because if a babysitter or a sibling or a parent is
Hmm.
watching the child, what do you do and how do you do it the way that the parent would want it done? Um,
Absolutely.
yeah, it's
Yeah.
super important. And I love what you said about having the appointments in your phone. So,
Yes.
but not only that, having reminders a week before and a day
Uh-huh.
before. Because it can be in the
Absolutely.
phone, but you're not going to see it till the day of, and then
Right. And
you
you've made
forget.
other plans or something else came up. Yeah.
That
So
is so
I'm a big proponent of that because I'm like, if it's not in my phone, I'm going to forget. I can't remember everything.
great.
So having those
Mhm.
reminders automated really makes a huge
Yes.
difference.
Absolutely. And I know we do this a lot in nutrition coaching as well, where, you know, you time block and you have exactly when you're supposed to eat and what you're eating
Mm.
on your phone.
Hmm. Hmm.
But I love adding that reminder like a week before or a day before, so you know, and you can prep for success in anything that you're doing
Absolutely.
for your life.
Absolutely. Yep.
Fantastic, so important. Okay, so the next question that we have from our viewers is, do you have any resources for kids' health? Like, where can parents go so they're not Googling, because we know that's the worst thing we can do as parents or as humans. So what tips do you have for us?
Yes. So there are a few things I would recommend, depending on the rapport you have with your pediatrician, certainly they should be the first resource. A lot of, or the vast majority of pediatrics is preventative care and anticipatory guidance. So as the child's growing, you want to inform the families as to what to expect, things to look out for, developmental milestones and the like. So having good rapport with your pediatrician is critical. And I always tell families, you want to feel comfortable seeking that medical advice and going to them. Additionally, since we all are on the go and on the phone, I would say with the content I've built up, it would be great to access our website, which is premierpediatricsolutions.com. We have content built for parents and caregivers specifically, because we know it can be very challenging sometimes to get that appointment with the pediatrician, or it might be weeks out. And if you need just quick information and tidbits that are, as you said, like vetted professional information, different clinical outlets, our website, premierpediatricsolutions.com, can serve as that as well. Additionally, I would say general kids health information you can find at kidshealth.org. This is content around typically common medical issues, complaints, like I said, like a stomach bug or fever control, things like that. And then the other component I would mention is the American Academy of Pediatrics. So AAP.org is another good website to have as reference. And just like everything, if you can have these websites kind of saved in note form or something as a quick reference, it's going to help a lot, because as you said, Googling, you can go down a rabbit hole. There's lots of misinformation, people who do not have credentials who are, just posting things online, and it can be very tricky and misleading for families. So I would say keeping those websites that I mentioned as a reference, that'll be a great start for you. In addition to having good rapport with your pediatrician.
That's fantastic advice and tips, because I know, and I love the part that I want to talk about quickly is that Keeping them on your phone in your notes.
Yes.
Our
Yeah.
phone is such a good resource when we use it properly, right?
Yes.
In that
Yes.
moment of panic or that moment of, frustration, your kid's screaming, right? Or
Right.
moving everywhere. You don't want to be
Uh-huh.
looking all over the place for the websites that you already know are trusted sources. So
Absolutely.
on your phone and just clicking on it, and then you're good. You have the information. You can look it up quickly and just be a better parent for your child.
Absolutely.
And that's fantastic that you have your own website that has great tools and resources for parents, as well as the other websites. And I think also too, feeling comfortable with your pediatrician, that's spot on, Dr. Allen, because if you have a good rapport with anybody, but especially the caretaker that's in charge of the medical care of your child, you're not gonna feel awkward calling them or asking a question or uncomfortable, right? Because this is your child you're talking about. And so you wanna have that good rapport with them and know that they or their staff are gonna get back to you in a timely manner. Especially when it's something urgent about your child's care. So,
Absolutely. Yeah.
So the next question we have is, are there specific questions to ask doctors when you're at an appointment with your child or children that are not obvious? Because we all know we go in and we ask the obvious basic questions, but are there other ones that we should be asking that would help us be better parents in taking care of the health of our children?
Yeah, so the way I approach this, and again, I come from the lens of pediatric emergency medicine, fast paced, things are dynamic. But this is a question that I hear often from parents when I see them in that clinical context, even. And what I would say is it's kind of a two-part process. The first thing is, as best you can, in our busy lives, try to keep tabs on what's going on with your child. And what I mean by that is, for example, going back to the phone, it's certainly if you have a good rapport with your child, hopefully you're discussing, everything under the sun, how their day has been, social life, school, academics, everything, their wellness, just overall physically, but mental health. And as you have that rapport with your child, if something does come up that you're concerned about or they're concerned about, I usually recommend just keeping a log of it. So if in your phone you have, a notes section, and for Junior, you can say, Junior mentioned X, Y, and Z. And so you have that kind of note made so that when you go to the pediatrician, it might be for just a well child check, but you can mention, say, hey, you know what, a few weeks back, Junior mentioned this, and then you can open that door for discussion, because it is very common, physicians, we're human as well, especially in either a busy ER or a clinic office. We have lots of patients we're seeing. So it's really helpful for us if the parent brings those top 2 or 3 concerns they have to the visit. So again, having that documented log of things that have come up and having it as a reference point to then mention it to the pediatrician when you see them is going to help us, because it's normal that you can't remember every single thing off the top of your head. But in that moment, when they say, hey, do you have any other questions, or is there anything else going on, or are you concerned about X, Y, and Z, you can go back to that reference point and say, hey, you know what, about a month ago, Junior mentioned this, and then that opens the door for the dialogue. So I think that's really, really important. And to again, say you have your appointment in a week in advance, the day before. It sounds kind of corny to say, but just kind of review. Think of, okay, we have the appointment tomorrow. What are the things I want to bring up? What are the things I want to discuss, so that you optimize the visit and you make sure that your child's getting the care that they need, and also keeping the pediatrician informed. I always say that, it's a two-way street. I liken healthcare relationships like dating. Like, every clinician is not for every family or every child. And if you have that good connection, you feel that the clinician trusts you, that they are competent in their field, that's something to really cherish and take care of. But it has to be a give and take. So if you come to a visit and you're not really divulging a lot of information, or you're not really engaged, it's going to be harder for that clinician to take care of the child well. So I always recommend, as best you can, keep a little log, a notes section about what's going on with your child, any concerns that come up, have that documented so that when you go to the visit, you'll be ready to discuss those things, even if they don't initially come up or pertain to that visit at hand.
Absolutely. I think that's spot on. I know, a lot of people, including myself, I'll keep notes before I go to the doctor for myself because
Right.
I don't forget, but I've never done it for my kid. And
Yeah.
a lot of parents like that. You think that you're going to remember or like it's not important anymore or just in and out. So when
Right.
having, again, going back to the phone being such a useful tool for us, having the
Hmm.
and just writing down as it happens, and then you have a list, or if you think of
Yeah.
something to write it down so you don't forget or you don't have to call back or wait for a response from the portal, which are great. But if you're there, live, you might as well ask every question you want about your child because you're the caretaker, and the doctor is there for you. They're there. They want to answer your questions. They want to help you and help you
Yeah.
as best they can. So
Absolutely.
super important. Those are such great tips. And going back to also what you said about having that good rapport with the doctor or clinician is also spot on, I believe, because when you have that relationship, you're not going to be hesitant or afraid to ask a
Hmm.
question. And you're going to be more apt to just have an open dialogue and conversation, and your child's going to feel that energy, so they're going to feel more comfortable.
Yes.
I know, with my son, when he was little, we went to, it was a practice of like 5 doctors, but we went to a female doctor. And then as he got older, we switched to a male because that's what he was comfortable with. They were all fantastic doctors,
Right.
it's just what he was, and I loved them all. So for me, the rapport was the same.
Good.
So it does make a huge difference. So thank you for sharing that. Um,
Yeah, and it's really good that you say that. I want to underline what you just mentioned about your son taking initiative and saying, "Hey, I would be more comfortable with a male doctor." It's that dynamic of as a pediatrician, right? We're not the parent, but we have the child's best interest at heart. And so I always recommend to families, and you don't want to come off offensive or inconsiderate, but empowering your child to be able to speak up for themselves and tell about what's going on with their bodies or how they're feeling is so, so important because as you mentioned, as they're growing and getting into adulthood, that's reality. That's how life is. So if they're not able to speak up for themselves and talk about how they're feeling or what they're going through or what's happened, that's going to play out into adulthood. And so as young as I can, even toddlers, I'm talking to them directly. I want to, hear their thoughts. And I think that's something that can be really a great tool for families to instill in their child so that they are comfortable with the clinician. And it really just takes effect in every aspect of their life in terms of, school and just being able to speak up for themselves,
yes.
stay safe, all of those things. So
Yes.
that's something else I want to highlight to make sure that the families, the caregivers, are empowering their child to be engaged during the visit and speak up.
Absolutely. And that brings up another point of self-advocating. So, as a parent, it's just natural to
Hmm.
advocate for your child. But there comes
Right.
a point where it's empowering for them to allow them to be their own self-advocate. And you're kind of in
Hmm.
the background just to make sure what they're saying is the right thing, but not
Right.
intervening because it may be the right thing for them, but maybe not what you would say. But that's the
Right.
question they have at the moment or what they're asking. And that what you mentioned as well, it just helps them throughout their whole life, Dr. Arnold.
Hmm.
So being the self-advocate and voicing their opinion, whether it's, to be safe, to be healthy, to, ask a question in class and not feel embarrassed, and all of those
Hmm.
things. So that's
Yeah.
really good points. Um,
Yeah.
okay, so the last question we have for now from our viewers is, if the parent has an autoimmune disease, will the child automatically have it? And when should the child start being tested for that autoimmune disease?
Yeah, so this is a good question. And what I would say is it's two parts. If you have an autoimmune disease, will the child have it? Not necessarily. As you well know, there is a whole slew of different types of autoimmune diseases, and the inheritance and penetration is variable in terms of what's passed on and if it will actually clinically manifest. So it's not an absolute, but what I would tell every parent who has an autoimmune disease, this is a discussion that you want to have early on with your OB-GYN. So if you're thinking about getting pregnant or planning to get pregnant, these are discussions you want to have with your OB-GYN in terms of your specific disease and what the transmission rates are like and what that would look like in the child. And then going forward, if you do have a pregnancy, And there are certain options at different points during the pregnancy where it might be valid or reasonable or prudent to do certain testing to see if the child does carry the same autoimmune disease. So the short answer is it's not 100% that the child will have it, because all things are variable in terms of the inheritance and how it's passed down. But you should certainly think of it sooner than later. If you do have an autoimmune disease and are thinking of getting pregnant, you want to speak with your OB-GYN about those issues so that you're prepared during your pregnancy.
Yeah, and those are such good points, because, I don't think having an autoimmune disease should prevent you from having a child, but being
Absolutely.
and being proactive versus reactive is so important for your health and your future baby's health.
Absolutely.
And then there's the other side of that, where it's this is from in my life, and what happened to me is that I got diagnosed with an autoimmune disorder after I gave birth, 3 years later. So, and I don't know, no one will ever know if it happened right when I gave birth or 3 years later, but I was diagnosed 3 years later. And it's very common. I have Hashimoto's thyroid autoimmune disease. And it's very common that women in their 30s after they give birth, and I was 31, develop this autoimmune disease. And so, like what you said, Dr. Allen, it's not, not necessarily my son will have it, and we don't know. But when I got diagnosed, he got tested and he did not have it. But that doesn't mean that he is never going to get tested again. So he doesn't have to get tested every year or blood work for that specific autoimmune disease. It's, when he gets older, and like what you said, just talking to your child about it and having the awareness and understanding it, that it's not life-threatening, but it is life-changing. But you're still able to thrive when you figure out your solution. So not all of them are hereditary. So you just don't know, but having that awareness and just having an open conversation is super important. Absolutely. Is there anything else that you'd like to add to this incredible conversation about parent tips and health for their children? I've blown away with the amount of information you've given so far. So just any last comments or words you'd like to share?
Yes, well, it's been my pleasure. And as we discussed, I would just certainly say for all of the caregivers, parents, moms, dads, everyone out there helping raise a child, just please make sure you take time for yourself. Make sure that you are doing what you need to do in terms of your own health and wellness. And just make sure, ideally, I would say a few things. Try to build good rapport with the pediatrician or the clinician who's helping take care of your child. Make sure you have those resources, as I mentioned, our website, premierpediatricsolutions.com, and other reference points to help give you information around kids' health. And certainly you can check us out on IG or Facebook at premierpediatricsolutions.com. Our pages are active. We have a lot of good content there. And then you can also follow us on LinkedIn as well. You can just look me up, Alana J. Arnold. Or also follow our company page, Premier Pediatric Solutions, too.
Fantastic. And what we'll do is we'll drop the links right below for your connections and how to get in touch with you and your website. If anyone has any questions or just wants to connect and ask, or get the resources that Dr. Allen was speaking about. And we're just so excited that you were able to be with us today on Wellness Wednesday with Thriving with Autoimmunity here. And Dr. Allen, thank you so much for all of your expertise and your knowledge and your time. And I love what you said. I'm going to end with this, is that, you got to take care of yourself first before you take care of your kids, because if you don't put yourself first, you're not going to have any room to fill your cup up with your kids. So
absolutely,
it's inward, outward. Love yourself first, take care of yourself first, so you can and are able to take care of your children. So thank you very much, Dr. Allen. Appreciate you so much. And we look forward to speaking with you again real soon. Thank you.